Good day, dear colleagues. First of all, it's a great pleasure to take part at this scientific conference. My name is Aleksey. I'm from Ryazan. Ryazan is a small city near Moscow. And the topic of my report is ethylmethylhydroxypyridine Succinate, brand name Mexidol, mechanism and clinical evidence in ischemic stroke. First of all, stroke is a rapidly developed clinical signs of focal or global disturbance of the cerebral function lasting more than 24 hours. In Russian Federation, stroke is a predominant cause of disability. There are two types of main types of strokes: ischemic stroke and hemorrhage stroke. And ischemic stroke accounts for 87.5% of recurrent strokes. Such trends underline the importance of focusing on the primary prevention of stroke among all age groups. Allowing the clinical guidelines, there are 7 main types to prevention of ischemic stroke. You can see such steps in the picture. For example, to decrease lipid level, to decrease blood pressure, data monitoring, and etc. What is about treatment? There are different types and approaches to treatment of ischemic stroke, but the most effective is recognition therapy. There are 2 types of recognition therapy: thrombolytic therapy and vascular thrombextraction. Evidence-based data you can see on the left. It's about thrombolytic therapy and the vascular thrombextraction. The evidence-based data you can see on the right. However, the limits the use of thrombextraction therapy is limited by narrow therapeutic window and a lot of complication of revascularization. For example, thrombolytics may cause hemorrhage transformation and a lot of contraindication for such treatment. That's why it's very actual to study new approaches to treatment of ischemic stroke. One of them is neuroprotection. Neuroprotection is salvage the ischemic penumbra, the area of the brain tissue surrounding the irreversibly damaged core that is at risk but still alive. At this picture, you can see red, this is a core of ischemic stroke, and yellow sign is the penumbra. By interrupting the destructive ischemic cascade, these therapies aim to extend the narrow window for treatment and improve recovery. The term of cerebral protection is equated with the term cerebral cytoprotection and include neuroprotection, the protection of neurons, glial protection, protection of glial cells, and vascular protection, the protection of blood-brain barrier and reduction of vascular permeability. It's interesting that neurons inhibit the greatest vulnerability to hypoxia, astrocytes, the least, and the pericyte and endothelial and intermediate vulnerability. The term cerebral protection includes the protection of each element of the endovascular unit: neuroprotection, vascular protection, and glial protection. To discover different drugs, we must know pathogenesis of ischemic cascade. It includes different stages and processes. For example, excitotoxicity, oxidative stress, inflammation, and apoptosis. Oxidative stress plays an important role in the pathogenesis of ischemic stroke, and it's an important pharmacological target since patients present to the physician at the time of maximal oxidative stress development through the hours after start of ischemic stroke. The development of oxidative stress during cerebral ischemia was first described in the 1988. Since this moment, different scientists start to discover different agents that can decrease oxidative stress, and such drugs receive name antioxidant. At this moment, antioxidants are substances capable to delay or inhibition the free radical oxidation of substrates at low concentration compared to the concentration of oxidized substrates. A lot of scientists tested at this moment test of different antioxidants or discovered a new mechanism of action. You can see a lot of work from China, for example. One of the most effective drug is Ryazan. Ryazan was the first developed in Japan as a free radical scavenger. It was initially approved for the treatment of acute ischemic stroke in Japan. Ryazan was also approved for use in the Japan, South Korea, and the United States of America for the treatment of amyotrophic lateral sclerosis. In ischemic stroke, Ryazan, it was found that in the meta-analysis included 15 studies, a lot of patients. It was found that Ryazan was associated with a significant reduction in the risk of mortality compared with the control. But my report is about Mexidol, is a new Russian drug, structure Ethylmethylhydroxypyridine Succinate. It's original Russian drug with antioxidant, antihypoxic, and membrane stabilization activity. It's very interesting that the free radical reaction was discovered by outstanding Soviet and Russian scientists, Nobel Prize laureate Nikolai Semyonov, which describes such reaction in vitro. And after that, started to discover a different mechanism in vital subjects. What about the mechanism of action of Mexidol? In silico study, it was shown that Mexidol can interact with free radicals, and also Mexidol can bind with different ions, for example, iron and copper. Such ions stimulates or catalyzes free radical reaction. In a vitro study, it was shown that Mexidol can bind free radicals, for example, superoxide anion radical and hydroxide radical. It's very important that Mexidol also increases the activity of antioxidant enzymes. Such enzymes protect cells from the oxidative stress and inactivate products of lipid peroxidation. Mexidol increases the activity of superoxide dismutase and glutathione peroxidase in vitro. Such action is produced by oxypyridine, but there is another functional compound, succinate. Succinate is a component of Krebs cycle, and succinate normally provides the synthesis of two ATP molecules. It was very interesting that in 2004, special succinate receptors were discovered. The special ligand of such receptors is only succinic acid. Such receptors act through the protein kinase. Such receptors also found in many organs and tissues, and activation of succinate receptors enhances cell tolerance to hypoxia. Also, it was shown that succinate increases expression of transcription factor HIF1 alpha and VEGF and stimulate vasculogenesis. In vitro experiment, it was compare the efficacy and safety of Mexidol and Ryazan. It was shown that Mexidol is the same effective like as Ryazan, but Mexidol is a less toxic substance than Ryazan. Do you remember that Ryazan is one of the most effective antioxidants in the clinical practice at this moment? Toxicology of Mexidol. Mexidol is a non-toxic agent. In a lot of study of different animals, mice, rats, rabbits, it was shown that Mexidol doesn't affect the reproductive function of the male and female rats. It doesn't exhibit mutagenic effect. And when we administered Mexidol at a dose 150 over 6 months, only minor adverse effects were observed, such as elevated blood lipids and globulins. Pharmacokinetic of Mexidol. Mexidol is rapidly absorbed and rapidly eliminated from the body. Maximum concentration is reached on average 30 minutes, and therefore Mexidol is prescribed 3 times a day. It's very important that Mexidol can penetrate the blood-brain barrier and reach brain in high concentration. In such concentration, Mexidol can bind and activate different free radicals, and that's why produce antioxidant effects or activity. There are a lot of studies in which we studied neuroprotective activity of Mexidol, and in this picture I will show one of them. This study was performed on male with rats. Focal cerebral ischemia was reproduced by endovascular occlusion reperfusion on the right medial cerebral artery by Koizumi method. The duration of occlusion was 60 minutes. During the beginning of reperfusion, and the animals were given single intravenously injection of Mexidol at a dose of 15 milligram per kilogram. At 24 hours after the start of reperfusion, the brain infarct size was analyzed. And it was shown that Mexidol in a single injection led to decrease the volume of necrosis. Also, it was found that Mexidol increased the level of expression of different neurotrophic factors, suppressed neuroinflammatory, and inhibit apoptosis in the ischemic area of the brain. Clinical trials. It's very important to improve clinical efficacy and safety of different drugs, and such drugs were performed, for example, EPICA at a multi-center randomized double-blind placebo-controlled parallel group study on the efficacy and safety of Mexidol in long-term sequential therapy in patients with hemispheric ischemic stroke in the acute and early recovery periods. 150 patients with ischemic stroke in 11 clinical centers in Russian Federation received the study therapy. 124 patients were included in the analysis. Patients were divided in two groups. First group received Mexidol in the doses of 500 milligram per day intravenously, or another group received placebo during 10 days. After that, Mexidol will administered orally in a dose 125 milligrams 3 times a day during 2 months. At the end of therapy, it was shown that level of functional dependence was significantly higher in the Mexidol groups as assessed by the modified Rankin scale. You can see this in picture. Also, neurological deficit was significantly lower in the Mexidol therapy group when testing using the National Institute of Health stroke scale at the end of therapy. You can see also these results in this picture on the visit number 5. And also in the both groups, statistically significant difference was observed between the baseline values and the values at the end of therapy. A statistically significant difference between the groups was identified at visit number 2, 4, and 5. It's very important to test not only efficacy but also safety of different drugs during clinical trials. And also in such clinical trials, we tested the efficacy and safety Mexidol, and it was shown that no significant difference were found in the frequency of adverse reactions and serious adverse reactions between patients in two groups, 3 cases in placebo group and 1 case in Mexidol group. Another clinical trials, the name MIR, evaluation of the efficacy and safety of sequential therapy with Mexidol in patients with acute and early recovery periods of ischemic stroke. This is international multiple randomized double-blind placebo-controlled trials, 17 clinical centers, not only Russia, but also Kazakhstan and Uzbekistan. 304 patients were divided into 2 groups. First groups, Mexidol, 500 milligrams twice daily intravenously during 10 days, or placebo, and after that, start oral therapy, Mexidol 250 milligram 3 times a day during 6 days, or placebo. And it was shown that Mexidol restores function more rapidly and reduce the degree of disability compared to the control group. This is modified Rankin scale. Also, it was shown that Mexidol therapy reduced the level of disability and the degree of patient disability after ischemic stroke. So, present placebo, 60% patients in the Mexidol therapy group had no disability at the time of therapy completion. And safety. The results of statistical analysis demonstrated that the absence of significant difference between the comparant groups in terms of the main safety indicators. For example, 6 cases in placebo and 4 cases in placebo and 6 cases in Mexidol. This indicates a good tolerability of the therapy with Mexidol and the absence of drug interaction with standard therapy medication. In summary, the present date indicates that Mexidol is effective and safe medical product. Moreover, in most studies, the positive effect of the drug was achieved through the long-term sequential therapy, which included a course of Mexidol injection, first of all intravenously of 500 milligrams for 10-14 days, followed by a switch to oral form of 250 milligram or 125 milligrams 3 times a day for 2-3 months. Because Mexidol is effective drug in Russian Federation, Mexidol is included in the clinical recommendation or clinical guidelines to treatment of ischemic stroke. Thank you for your attention.